Dear members of the Global Health community here, the Global Health Hub in Germany, distinguished guests, ladies and gentlemen, first of all, I'm honored to welcome you all to the annual Global Health Talk hosted by the Global Health Hub community Germany. And this is my second year as a minister opening the Global Health Talk. I'm glad to see that this format remains successful in bringing together renowned experts in the field of global health here at the Umweltforum in Berlin. 2023 is a significant year for global health, offering multiple opportunities but also challenges to accelerate progress towards achieving the health-related Sustainable Development Goal 3, ensuring health and well-being for all. All things considered, roughly speaking, about half of the population worldwide do not enjoy a full coverage of universal health coverage. This is an untenable situation, one of the issues we address here in this community. In September, 3 UN high-level meetings will be held on the interconnected topics universal health coverage, pandemic prevention, preparedness and response, and tuberculosis. I will join the talks in New York. This will be a unique opportunity to develop comprehensive political declarations on the most pressing aspects for the three aforementioned topics. Most importantly, it will ensure high-level political commitment from all countries around the world. Additionally, we have participated in the complex negotiations of a new international pandemic accord, which is currently happening, headed out of Geneva, which will be an important tool to enable better preparedness for and coordination in the event of future health crisis. Finally, in 2023, and this is the last challenge and opportunity at the same time, the World Health Organization celebrates its 75th anniversary. This milestone is an occasion to reflect on past achievements, such as the establishment of the international health regulations, which are currently being amended, and the successful eradication of diseases such as smallpox and hopefully and soon polio from the world. Let me at that point also draw your attention at the crisis that we are suffering from the decelerating progress in improving healthcare for all. Russia's barbaric war of aggression against the Ukraine is one of these crises. I'm distraught by the persistence of this situation that is causing so much suffering, so much pain for so many people. Germany clearly stands with the Ukraine. We do whatever it takes to support the Ukraine. We help immediately in providing prosthetic devices, for example, taking severely wounded people to Germany, but also other European countries, and we support the people living here in the Ukraine while they have to flee the country in providing them with the same full coverage of universal health care that Germans do enjoy. This is the least we owe to these people, and I would like to ask you to reconsider such a. No one would have believed that such a horrible war in the midst of Europe is possible in so short a period of time. So let me condemn this war at that occasion and assure the people of the Ukraine that we will stand with them whatever it takes. We are also facing more long-term challenges, and I think it is clear that the most important long-term challenge which we have to deal with is the climate change. Climate change in these days is the mother of all health threats, as a matter of fact. We will see more pandemics as a consequence of climate change. We will see more poverty, more drought. We will see more crisis, more health crisis directly, but we will also see more armed conflicts. So therefore we have to do whatever we can. We have to regard climate change as a health crisis, not only participating in a health crisis, but it is a health crisis in itself, and we have to take care that we do not forget. This is by now a topic that everyone is aware of, but little is happening, as a matter of fact. So therefore we need a generation which makes it its own goal and task to deal with climate change. We need a Fridays for Future generation worldwide, but we also need a group of young people who develop their life to global health. And therefore it is a wonderful occasion here to meet with you, because a hub like ours is such an occasion where young people come together and decide perhaps to devote their lives to the prevention of global health crises that we are facing in the future. Despite the recent crisis, we are approaching the midway point towards achieving the 2030 agenda. Since recent health crises have rightfully shifted our focus, it is crucial that we come together, that we pool our resources and coordinate our efforts. Let me point out that while we focus on the road ahead, we should also not forget the past health crisis and the lessons we have learned from them. The COVID-19 pandemic is far from over. Millions of people worldwide are suffering from long COVID, and we must unfortunately deal with the threat that people who will be infected in the future will also be prone to long COVID, despite the fact that with vaccination, the risk of developing long COVID is reduced. It is not fully eliminated, and some researchers believe that a 50 to 70% risk of developing long COVID is still there in comparison to, let's say, developing long COVID unvaccinated. That means that millions of people in the long run may entertain long COVID. And we also learned that long COVID is a disease that makes you prone to future diseases in the future. For example, neurodegenerative diseases that may occur, atrial fibrillation, heart disease, and other consequences. So therefore, the pandemic is not over, and we have to draw lessons how we develop measures that will make it more unlikely that new pandemics will happen. In that sense, we are working currently on the pandemic accord together with WHO and other central institutions. It is crucial that we commit ourselves to strengthening the pandemic preparedness and response landscape across different fora, including G7 and G20. And for G7 and G20, pandemic preparedness has been a major issue. Germany has put forward the idea of creating a pandemic fund while we were heading the G7 group, and this pandemic fund has by now been established at the World Bank, and major researchers are supporting this, that the crucial idea of establishing a workforce which is better prepared to, let's say, recognize pending pandemics and to prevent pending pandemics out of outbreaks, that this work is carried forward by means of education and also sustainable technical preparedness. And the pandemic fund is providing the finances that are needed in order to make this pandemic preparedness available, in particular to the poorest nations. We have to develop lessons from post-COVID, and we have to prepare our healthcare systems. It has been shown again and again that healthcare systems which lack universal health coverage and which are underfunded are the healthcare systems which develop the most dire consequences from pandemics, and that was visible in the COVID pandemic again. And within all healthcare systems, it is the poor and the underprivileged that sustain the major losses and sustains the major damages. So therefore, it's also a matter of justice that universal health coverage and pandemic preparedness are seen as one goal, as a matter of fact, and it is only possible to go forward here in avoiding pandemics, because pandemics make poor healthcare systems poorer and destroy universal health coverage, and on the other hand also to prepare universal health coverage, because universal health coverage is the best means in order to avoid that pandemics develop the consequences that they develop in countries where universal health coverage is not available. For that reason, we have to strengthen WHO, and we have to strengthen WHO's role in the future. But let me express at that point that the pandemic has also shown how needed WHO is and how successful WHO is, because without WHO, the consequences of this pandemic would have been much more dire. Millions of people owe their life to what WHO has done, so therefore let me express my impression and my deepest gratitude to WHO for what it has done. Without WHO and without the, let's say, efforts of WHO, the pandemic would have been way worse than it has been. As we are pleased to note, Germany spearheaded the decision to raise the assessed contribution for WHO by 20% in the years 24 and 25, which was approved at this year's World Health Assembly. I think this is a very good, a very important decision, a decision that we have prepared, that we have helped to prepare, but it is quite clear that in the long run, WHO needs even more assessed contributions in order to be able to fulfill its role internationally. We need WHO to be strong and sustainably financed in order to fulfill its leadership role, as it has demonstrated by the pandemic in the dynamic process in the current negotiations, also for the pandemic accord, which is very important. The goal is to develop a coordinated draft for the World Health Assembly in May 24, and I'm very confident that that WHO is able to finish this task. The negotiations are going very well, and we follow the negotiations on a regular basis and are in touch with WHO in that respect. Accord is to contain a series of legally binding regulations. We have a number of regulations already, but these regulations so far are not legally binding, and I think it is very important that the pandemic accord on which WHO is now working comes up with legally binding regulations and commitments which will then help us to face the future pandemics in a better prepared way than we did in the past. It is also important that this pandemic accord does not create many new institutions, but that does it coordinate the existing landscape of organizations and institutions which are out there already, so that we come up with a strengthened landscape without reinventing the wheel and without wasting resources. It is also important that we more clearly deal with the countermeasures which are needed when new pandemics threaten the world population. And it's here important that there's a more just distribution of the countermeasures in the future that includes vaccinations and also other measures of preparedness. And this is a very important aspect of the pandemic agreement on which WHO is currently working with the member countries. Universal health coverage is needed in order to make healthcare systems more resilient, and therefore the designation of 23, the year of 23, as the year of universal health coverage is very pertinent, is fitting, and it is very important that we achieve universal healthcare, which is often not possible because there is a lack of sustainable finance mechanisms, and Germany is a country which can help, like Japan, in order to find new sustainable finance mechanisms which are needed in order to exchange best practice work and examples which are needed. Germany's social security system, for that reason, is an example that many countries take into consideration, and we do whatever we can in order to explain our systems in a fair way, both its strengths but also its weaknesses. The Global Health Hub Germany plays a significant role in advancing the mentioned global health issues by serving a central network that facilitates dialogue and collaboration. I think that the value of this dialogue and collaboration cannot be overestimated. This is very important, and I think that our today's meeting and the agenda which we will basically explore in these meetings is exactly what is needed in these days. Without the pandemic, it was a very wise decision to come up with this hub, but after the pandemic, it is clear that it is just in time, and I'm therefore proud to hear that the membership by now is already exceeding 1,500, which is a very substantial membership. A variety of topics will be addressed here by the Global Health Hub Germany, and the members of my team will explain to me in detail what the discussion has created in terms of, let's say, suggestions for us, but also results. I'm very keen to look at these results. And let me point out that we are also now approaching very hot days. I therefore appreciate very much that climate and health, also heat preparedness, is a very important topic that you will discuss on this very important occasion. We will have a meeting about this topic tomorrow, and I'm very keen to learn from you what your suggestions are. Let me finish up in pointing out the hub is invaluable in bringing diverse perspectives together and making them accessible to policymakers such as me, but also other ministries. I'm very pleased to hear that the respective ministries are represented here on a high level again, and I think we will also discuss the results of this year's hub's discussions in our formats. It is very important. I wish you very successful days and exciting discussions. I would have liked to participate in the discussions. You believe me that this is exactly the type of work, exactly the type of discussion that I've enjoyed through my entire career as a scientist, but also as a politician. But again, I'm looking forward to the results. I wish you a wonderful time. I wish you very successful days. And I'm looking forward to discussing the results with you. All the best, and thank you for being here. You are the resource that we depend on, we as policymakers. So thank you for the occasion.